anytime we're making our body do something that it's not quite ready to do, there are potential repercussions for that. You must always weigh the potential benefits versus the potential risks when doing any of these things, natural or otherwise.
Hi, I'm Rachel, owner of the NaturalBirth site, certified birth doula, childbirth educator, and midwife's assistant.
And I'm Tiffany I, certified birth doula, lactation counselor, and midwife assistant.
Here, you'll learn all about different aspects of pregnancy, birth, and postpartum.
Remember, none of this information should take the place of your care provider and is not medical advice.
Birth is not a medical emergency.
Thanks for listening.
Hi, everybody. Welcome to the Natural Birth Talk. I'm Tiffany.
And I'm Rachel.
How are you, Rachel?
Cold.
On this beautiful, icy day.
I think that's just going to be the theme of the next few episodes. You're going to ask me how I am, and I'm going to say cold.
Cold, right. Yeah. Last week it was snow. This week it's ice.
Yeah.
Unfortunately.
It's pretty rough over here.
Yeah. I'd much rather have snow than ice.
For sure, because then my kids will go play in it.
Yeah, right. Yeah, I know, it's crazy. This Southern Illinois winter is always, you never know if it's going to be like 70 degrees or, negative
10. Right.
Yeah.
Okay. So both of us are super excited about our topic today. What is it?
Natural induction and natural augmentation methods.
Yes. We're going to really focus on the kind of natural stuff. And then next week, we're going to really get into the not as natural stuff.
Right. Exactly.
The medical stuff. So,
yeah. Okay.
Let's get started.
So first, what is even an induction of labor? So according to ACOG, labor induction is the use of medications or other methods to start labor before your own body has gone into labor, like on its own. There are lots of reasons. Sorry. What are you doing? Thank you. Go.
Sometimes I'm so tempted to just leave those little blips in because I'm like, we look human. Then like people realize that we're just like moms sitting in the quietest room of our house in what should be the quietest room, getting interrupted a million times, and then we're just trying to stay on topic, which I'm not great at.
Yeah. Okay. So anyway, why might somebody require an induction? So there are lots of reasons. So usually it's a specific health condition for like the mom or the baby. So an example or some examples would be like true preeclampsia, uncontrolled gestational diabetes, or true intrauterine growth restriction.
Or also known as IUGR.
IUGR, right.
I love how you say true because both pre-E and IUGR get mislabeled all the time.
A lot, yeah. And
then what's another really common reason for one of the midwife groups in our area to induce moms?
Well, I mean, there are lots of
Not that it's a good reason, but...
like big baby? Is that what you're talking about?
That's what I was thinking of. Yes.
Yeah.
There's one midwife group in our area who induces for, quote, big baby all the time. And it's just like, there's literally no way to know that your baby's actually going to be big. But it is a reason that a lot of providers give, but it's not an evidence-based reason.
Yeah. And studies show that like your provider just thinking you have a big baby is actually more dangerous than the baby being big.
Yes. Mm-hmm.
Yeah.
Because we rarely grow babies we can't birth.
Right. I mean, it just doesn't make sense.
Anyway.
So there are lots of other reasons that a person might be given for induction. So like Rachel was just saying, estimated weight of the baby, the mom's pelvic shape, their size, their age, their race, their mode of conception. So I know it's very popular around here. Like if you get pregnant via IVF, they want to induce you at like, whatever gestation.
Yeah.
The provider's fear of being sued, which is actually really sad and kind of ridiculous. Yeah. Convenience for either the provider or for the parents.
Yeah. I feel like the hospital in your town is so guilty of that.
For sure. Yeah.
Like always.
Unfortunately, none of those reasons that we just mentioned are backed by current research. So big baby, like none of those things are. So just something to keep in mind if your provider approaches you with any of those reasons, make sure that you're like really digging into if that is true or not. So
another one. Ooh, this is something I like literally just thought of. So maybe you were going to talk about this later. I don't think you were though. So another one is just like you reach a certain gestation.
Yeah.
Like a lot of care providers want to, or start recommending, or at least offering induction at 39 weeks. And that goes back to the ARRIVE trial, which showed
now we know is ridiculous.
ridiculous trial, but it showed it was slightly safer for
Mm-hmm.
a mom to be induced at 39 weeks than to be induced at 42 weeks. And by slightly safer, it just meant there were slightly fewer C-sections.
We should do an episode on the ARRIVE trial, because there was just some current research that came out about that, that I think would be really interesting for our listeners to kind of just dig into that, because I know that that's something, especially in my area where I live, that the providers lean on a lot. Like, oh, well, you should get induced at 39 weeks because it decreases your risk of a C-section. But we should dig into like all of that and why.
That's a good, because the hospital closest to me does the same thing. There's like the most popular care provider over there pushes 39-week induction. And it's really, really sad, guys, because that ARRIVE trial there were so many problems with that trial. So we'll stop and pause that for now, and we'll bring that topic back around later in another episode.
Yeah. Okay. So risks of labor induction. And I know specifically here we're talking about natural induction and augmentation methods, but I do want to point out that even natural induction methods they do carry the potential risk, to cause some issues.
Yeah.
Anytime we're making our body do something that it's not quite ready to do, there are potential repercussions for that. You must always weigh the potential benefits versus the potential risks when doing any of these things, natural or otherwise. But the risks of labor induction, more painful labor, longer labor, it increases your risk for infection. It increases your risk of a cesarean section. It increases your risk of uterine hyperstimulation. And then anytime there's a risk for hyperstimulation, or if the uterus hyperstimulates, there is an increased risk for uterine rupture for mom.
Yeah. And infection specifically becomes a risk because a lot of the times I've noticed, especially with like evening primrose oil or like acupuncture, it'll make your water break before labor starts. And that's
pumping, in my experience, like pumping.
Yes, pumping too. Yep.
Yeah.
It'll make your water break before labor starts, and then your water is broken or released longer than it should be, and that's when that infection like risk increases.
Right. Yeah. And because medications are usually used for induction, those medications can cause stronger contractions. And when I say stronger, I mean stronger than what your own body would make on its own, which has the potential to cause issue with baby's heart rate during labor. It also has the potential to cause breathing issues for baby, infection, and then feeding issues. Feeding, as a lactation counselor, that's something I see a lot. Even I always tell people, like, even though your baby could survive, like, being induced at 37, 38, 39, 40, it doesn't mean that like your labor should be induced. Like, just because the baby can survive doesn't mean that it's going to be like great for a baby. And a lot of those babies end up having feeding issues.
Yeah. Because baby lost like vital development time in the womb when it didn't have to worry about feeding. And then also the fact that our due dates can be up to 2 weeks off. Like, there's like a due date is really just a guess date. Like, we're just guessing, you induce a 37-week baby, that baby very well might only be 35 or 36 weeks if the due date was wrong. And there's no 100% way to know for sure. So
no, I agree.
So you really got to be careful when choosing induction.
Right.
Even with natural methods.
Yes. And then another risk of labor induction is it can start the cascade of intervention. So what is the cascade of interventions? This is the idea that using one medical intervention can lead to another medical intervention, which could lead to another medical intervention. So even something like, like we talked about a couple of weeks ago, like using IV fluids has the potential to cause, issues with feeding and swelling and, things like that. So, and then what is augmentation? So there is a difference between augmentation and induction. And augmentation is the speeding up of labor when a woman has already went into labor on her own. And they might tell you that you need this if your provider or location feels that labor isn't progressing, quote unquote, fast enough. If you've had a prolonged labor, or if your membranes release before labor begins. So if your water breaks before labor begins.
Or if you've had an epidural for a while and they're sick of waiting.
Right. Like labor isn't progressing fast enough, or prolonged labor. So of course there are risks to that. So honestly, the risks are really similar. So the risk of infection with certain methods, uterine hyperstimulation, and then something to think about too is like, what if your body just isn't all the way ready yet? Like if your labor starts and then maybe slows down, or if your water releases, and labor doesn't start for a few days, like it's okay. Like maybe your body just wasn't quite all the way ready yet.
Yeah. Well, especially if you're not running a fever and you're still feeling baby move and you're not showing any other signs like extra swelling or whatever.
Right. Yeah.
One thing I did want to mention actually when you were up talking about risk of labor induction, and then I kind of lost it, but it came back to me. So especially with medication induction specifically, but even potentially with natural ones, is you talked about how it risks hyperstimulation of the uterus or uterine rupture, but it also in turn increases the risk of hemorrhage postpartum. Because if your uterus is hyperstimulated or it's creating these waves or contractions that are stronger than it would have been, then your uterus is obviously going to be so much more tired by the end of the process. So then when you are, when your uterus is trying to clamp back down after you have the baby, it's not going to do as good of a job and you increase the risk of hemorrhage, which, generally can be handled with more medications. It's kind of that cascade of interventions, but it can be a very serious problem for some people too. So it's, we really don't want to increase that risk if we don't have to.
Right. Exactly. So we're going to go into like specific methods now. So the ones that I kind of want to talk about that I feel like are the most popular are using red raspberry leaf tea, nipple stimulation, sex, evening primrose oil, castor oil, dates, acupuncture, and pineapple. So the first one is red raspberry leaf tea. So this is the leaf of the red raspberry plant. It's most commonly consumed in a tea or a capsule, sometimes a tincture. It's traditionally used to treat issues with menstruation and childbirth. Like I know red raspberry leaf tea is something that I drink every single day. I make my own little herbal blend and red raspberry leaf is included in that because, I feel like there's something to that, right? When something's been used traditionally for years and years and years and years.
Absolutely. There's a lot of wisdom in those traditional practices most of the time.
For sure. So the reason why women use it, it's said to help strengthen and tone the uterus. There are some very small human studies on this. One showed that the consumption of red raspberry leaf tea helped to shorten labor, and it decreased the need for other medical interventions, including C-section.
Which is great.
And another showed that red raspberry leaf in capsule form helped to decrease the second stage of labor, the time spent in that second stage.
Which would be pushing.
Yep. However, red raspberry leaf tea did not induce labor in either of those studies. So there is no doubt that red raspberry leaf tea has nutritive benefits. It has lots of antioxidants, vitamins B, C, and E, magnesium, calcium, and zinc. I don't know. Do you have any personal experience with red raspberry leaf?
I just love it in general. And I've had a lot of clients come to me with a list of all of these things. And like, okay, what about all of these? Like, should I be doing these? And my general answer is no. But like with red raspberry leaf tea, it's the one that I'm like, no, you can do that one. Because it has so many other good benefits, not just induction.
Well, and I think that we both know that, or we both feel that like our bodies know how to have babies. Like,
absolutely,
we don't need any of these things to be able to birth our babies. And I truly don't believe that red raspberry leaf like induces your labor. I think that it may help ease your labor or shorten the time spent or shorten the amount of time spent in labor. I don't believe that it induces your labor. However, I do think it has nutritive benefits, which I think that is the real reason why it helps with labor is, all the nutrition that we're getting. And when I have clients approach me about red raspberry leaf tea, because again, I get the same thing you do. Like I go and they give me this list of things like, oh, should I be doing any of these things? Red raspberry leaf tea is one of the things that I'm like, yeah, if you like tea, if you like the taste of it, like, sure. But I recommend everybody mix it with other herbs like nettles, oat straw, alfalfa, things like that. Just for the extra nutritive benefits.
Absolutely. I love Pink Stork's Labor Prep Tea, and it is in the helpful products guide in the description, guys. We have a helpful products guide, and that red raspberry leaf tea, it's really Pink Stork Labor Prep Tea. It has red raspberry leaf, nettles, oat straw, whatever. And it's labor prep. Yes, that's the name of it. But really, like Tiffany said, it's the nutrition that comes from it. And like also mentioned is that a lot of people have said red raspberry leaf is a uterine tonic. So especially when I have a VBAC client, I'm like, drink your red raspberry leaf tea because if there's any chance that that is going to help strengthen your uterus, including your uterine scar, like hands down, we want to give yourself that one up. We want to give your body that one
and
up.
I think at the end of the day, like it's definitely not going to hurt anything.
Absolutely.
Yeah. So if you like the taste of it, like I do, like drink it. It's not going to hurt anything. So,
and the list of all of these things are really popular in natural childbirth ed classes. In the NaturalBirth site online NaturalBirth class, I talk about all of these things, printouts for it. And then I talk about how, these are all your options, but you really only want to use them if you are approaching a medical induction. But again, that raspberry leaf is it's just good no matter what.
Yeah, I love it. I think it tastes great. All right, so next, nipple stimulation. So why might nipple stimulation be a good option? We know that when your nipples are stimulated, really at any time, your brain produces larger amounts of oxytocin, which we know that oxytocin stimulates or can speed up labor. You can do this by using a breast pump, using, hands or a mouth, etc. Basically anything to get your nipples stimulated is going to work. There was a Cochrane review done in 2005 with a group of 719 women. 37.8 of those women used nipple stimulation and went into labor within 3 days.
Nice.
C-section was significantly less in that breast stimulation group versus the control group who didn't do nipple stimulation. There was another study done in 2014 that involved 200 participants. In the end, it was determined that breast stimulation increased the chances of a vaginal birth, and it did also help to ripen the cervix. Another study showed that it helped to increase a woman's Bishop score. Do you want to explain what that is, Rachel?
So the Bishop score is not my favorite, but it is used a lot when people, like care providers, are determining what kind of approach to take for an induction, or how likely it is that an induction might work for you. And so they're looking at the thinness of your cervix, the firmness of your cervix, how dilated you are,
where baby is in your pelvis. Yep.
And they're looking at all of those criteria and they're giving it a number, and they're just telling you, okay, I don't know, I can't remember exactly what the numbers are, but it's like, okay, this number means you'll probably have really good success with the induction. This says we should start with this method or whatever. It's just kind of an arbitrary way of, I don't know, rating an induction success.
Yeah, seeing like the likelihood of a vaginal birth. That's essentially what it is. But nipple stimulation can also be used as an augmentation technique. So do you want to talk about personal experience with nipple stimulation?
I have had several clients use this, specifically when their water has broken. So first of all, if your water releases before labor begins, usually it's because baby's not in a great position of some kind. There are other reasons, but that's the most common thing. So before starting nipple stimulation, I'm going to say balance your baby, right? We're going to use some spinning babies techniques. Once you have done that, though, nipple stimulation can be so helpful in picking things up. I've had several clients use it over time if they've had prolonged rupture, or if they're to use it to induce as well. So I've had clients use it for induction and for augmentation. And if it's done correctly, it really can be really successful. I think a lot of people make the mistake of like pumping for like 20 minutes at a time and just like power pumping.
Yeah.
And that's not sustainable. And that could overstimulate your uterus. And honestly, it's just going to hurt your nips. Like, they're not going to be happy with you.
Which is something you need to think about for after you have the baby. And if you're planning on breastfeeding, like that's something you should take into consideration.
Yeah. So I'll often say like 5 on, 5 off, 5 minutes on, 5 minutes off for like 20 to 30 minutes, then give it a break for a little while.
I feel like short intervals, it doesn't really matter what the interval is, but shorter intervals is better than pumping for 10, 15, 20, 30 minutes at a time.
Yeah.
Because I mean, ideally you want your body to produce that oxytocin. I feel like in those spurts that like kind of helps stimulate the contractions in those spurts versus, pumping for 30 minutes and then having like a huge uterine hyperstimulation issue.
Right. And sore nipples. And another thing to say too is this is not always going to work. This might start contractions that stop, and you have start and stop contractions. And I think pumping and acupuncture are the two biggest culprits of that, of these natural ones where contractions will start, but then they end up stopping later. And that can be kind of frustrating. But personal story for myself though, is with my third, I was hand expressing colostrum once I was like 37 weeks or so, and I would get contractions, and I had more pre-labor contractions with her than I did with any of my other babies. There were also some other things that could have played a role into that, but it was mostly, I think, that hand expressing colostrum, and I just wanted it just in case there was an emergency to have it set aside, which I think is a great option for people, to be honest, especially if you know that you've struggled to breastfeed previously. And then I ended up having like a 2.5-hour labor.
Yeah.
And so I really think that the pumping, while it didn't directly start my labor, or like the hand expressing, it didn't directly start my labor, but it definitely primed my cervix so that as soon as my labor did start, it was so fast.
Yeah. See, in my personal experience, it's been kind of the opposite with my clients. Like the clients that pump, especially for a long time, not like a long time, like 20 minutes, but I'm saying for weeks, like leading up to labor, because they want to induce their labor. Those clients are the ones whose water usually breaks before labor begins.
Well, yes, there's
and
that.
then they usually go for days with their water broken. So
yeah, that's very true also.
Pumping is something that they want to do, I recommend they wait until at least their due date to start doing that.
Yes.
Because I have had quite a few births in the past like 2 to 3 years where they've pumped and pumped and pumped, and then their water breaks, and then nothing happens for days. And that is more stressful for them than just waiting for labor to come.
Right. Well, and I think there is a lot of people who pump that much, that hard, really trying to start their labor. Like, even if your water.
Sorry, go ahead.
I was just going to say, even if their, labor does start, like, if you're trying that hard to get your labor to start in the first place, there's probably some like anxiety or some sort of something in your body that even if your water does break, even if your labor does start, it may not like fully start because it's, you're like.
The clients that I'm specific, there might've been one that was like that, but the other few just didn't want to be pregnant. Like they just were done kind of like being pregnant.
And that comes back to, I think pumping is better for augmentation than it is for induction.
I agree. I think once you're already in labor, I think it can be helpful if, for whatever reason.
Because really any induction tends to take longer than the birth itself would have taken.
100%.
So it's really, really rare for an induction to be faster.
Yeah. Right.
And that includes with these natural techniques, pumping specifically. So,
okay. Yeah. All right. So next one, sex. So why might sex be effective to induce labor? So when a woman orgasms, large amounts of oxytocin are produced, which we know can cause uterine contractions. Yep. And then semen also contains a large amount of prostaglandin, which we know may help to ripen/soften the cervix. Although there are tons of like anecdotal reports that sex helped start labor, there isn't really any research to back this up. But also, like, do we really need research to back this up?
Right.
Because there are so many women that say that this works.
Right.
If you're thinking like just in physiologic terms, then it only makes sense that sex would help to induce or augment labor.
Right.
But again, not until your body and baby are ready.
Right.
The past probably 2 or 3 clients that I've had, they all said that, they had sex the night before, labor started overnight, and then they had their babies by morning.
I think the struggle with sex is just mom like being into it at this point.
Well, yeah, right. And some people don't want to, and like that's totally fine.
Right.
I'm definitely not saying like if you don't want to have sex, like have sex. I'm saying like if that's something you want to do and you feel comfortable doing it, then you should do it.
Because it can definitely be helpful.
Yeah.
It's not going to hurt anything.
No, unless if you don't want to do it, then don't do it. But like if you want to and you're up for it, then you should go for it.
Absolutely. And I think that even if like, I know a lot of people are like, oh, I just was not into it, but I did it anyway because I really wanted to help induction. Like, okay, like the prostaglandin and the semen's probably still going to be a little bit helpful or something, but like that was not near as helpful as if you actually enjoyed it. And I think so many of us like do not.
Know,
we just don't enjoy it at that point because we're just like, I'm so uncomfortable.
Fine. Yep, that's totally fine.
It is a common misconception. A lot of people still think that you shouldn't have sex towards the end of your pregnancy.
I know.
And I'm like, okay, guys, like, no, that's not. Like,
no, girlfriend, if you're feeling it, like you should go for it.
Yeah, unless like you're already showing signs of like preterm labor.
Right. That's what I was going to say. Or if your provider has told you not to.
But like, it's
Yeah,
fine
it's
if you want to.
fine.
And it's
Right.
probably
And you
going to help.
should. Yeah. And then like throw in, I might be getting a little bit TMI here, but
That's
like
okay.
throw in a little bit of nipple stimulation. And
Oh,
then
absolutely. There's like 3 different ways right there.
right.
That
Exactly.
sex is
Plus,
helpful.
yeah, hopefully you're having fun while you're doing it. So like
Stress
do
release.
it. Right. Exactly. Yeah. Okay. So the next one is evening primrose oil. This is like one of my least favorite ones. I don't
Same.
know why it gets on my
100%.
nerves so much.
Well, I feel like it breaks the water early, like so often. Like even the local home birth practice has stopped recommending it.
Good.
Because like Maggie has said, like, let's stop recommending that as often because they're seeing that waters are breaking early, like really
guys,
commonly when this one's
you don't
used.
need anything. Like I understand medical conditions happen, right? And
Right.
like you have to induce labors in certain situations. But if you're having like a normal, healthy pregnancy, like stop. You don't have to do any of these things. Your body knows exactly what to do. Humans would not be here if our bodies didn't know how to give birth.
Oh, absolutely. Or if men gave birth.
Right. Like you don't need to drink tea. You don't need to like do all of these things, you know, to have your baby or your body and your baby already know what to do.
Exactly.
But okay, evening primrose oil. Sorry, I'm going to be rolling my eyes the entire time I'm talking about this.
I am right there with you though. Like, I mean.
So evening primrose oil, this is the oil from the evening primrose seeds. It contains a large amount of a substance called gamma linoleic acid, which is a precursor to prostaglandin, which, like we've said before, prostaglandin might help to soften or ripen the cervix, which, again, your body already knows how to do on its own.
Right.
What the research has found is that evening primrose oil does help to ripen the cervix, like when you're only looking at the Bishop score. But there isn't much research out there that shows that it decreases the length of pregnancy, it decreases the time spent in labor, or, you know, increases or decreases any risk to babies. Yeah. But anecdotally, Rachel and I both know that when our clients use this,
especially vaginally. So some people use it orally.
Yeah. You can take it orally or vaginally. Right. Yeah.
But especially when used vaginally, it tends to just make the water break, especially in like 41, 42 week moms. Like, which I guess for some of them, that's what they were going for anyway. But like, I don't know, there's just better ways.
No, I mean, I agree. I totally agree. But yeah, like Rachel said, there are different ways that you can take it. But
so I read a study that there was comparing orally versus vaginally, and orally they had shown that there was an increase in breathing issues among babies of moms who had taken it orally. Now, I really think that was probably a coincidence. I really think it probably was not related to the evening primrose oil, but it also showed that there was no positive outcome of taking it orally. So I never recommend it orally because I'm like, okay, even if that breathing issue thing was a coincidence, like if there's no positive outcome that was shown, like why do it? Whereas like some studies have shown that there is, like you said, some benefit to cervical ripening when looking at the Bishop score when it's done vaginally. Yeah. So like, if you're going to do it, I wouldn't do it orally because I don't think there's any benefit from what I found. Yeah. But, you know, and vaginally, it might help start your labor. But again, I don't think it helps start it in the best way. But
yeah. Also, I think I could be totally wrong, but I'm pretty sure there was also a small study. I didn't put it on our outline, but there was a small study that showed that it increased mom's risk of hemorrhage post-birth too.
Well, and that could go back to maybe if it hyperstimulates or causes the labor to be longer because the water was broken longer.
Yep.
That would make sense. Yep.
Okay, so castor oil is our next. So this is the oil that is taken from the seeds of the castor bean plant. There are reports dating back to ancient Egypt of women taking castor oil to induce their labor.
It is an old practice.
Old. So essentially, when women ingest the castor oil, it stimulates your bowels. So this may cause nausea, vomiting, and diarrhea, just FYI. This may be uncomfortable and cause dehydration. So just be very cautious of this. Especially if you're a VBAC mom or a first-time mom. And honestly, this is when I see all of these things like not work the best is when you're a first-time mom. You know, just FYI.
Because your baby and your body just aren't ready yet. Like first-time moms tend to have longer pregnancies than subsequent moms. And that's because like everything's just trying to figure itself out. And, you know, I mean, who really knows? But like it just takes longer.
Yeah. So essentially that's what's happening. You're taking the castor oil, it's stimulating your bowels, which can also stimulate your uterus to start contracting. If you take the castor oil, you don't want to take it straight. So
It's
you want to
nasty.
take it in a smoothie with like coconut water, fruit, and some type of nut butter is what I have seen to really help with those side effects, like some type of like fat and fruit and hydration, all kind of mixed together.
I mean, it's good nutrition anyway. And that's sometimes referred to as like a midwife's brew. Like if you see that out there, you know, it's something like this with castor oil in it usually.
Yeah. There are several studies that have shown that if you take castor oil, you are more likely to have a baby within 24 to 48 hours. And I have kind of seen that be the case too with my clients. Again, if they're past their due date, I have seen
that's when it's safer.
Yeah, I have seen this work. Or like, you know, sometimes if moms, like if their water breaks and nothing happens for a few days, I've seen this be helpful as well.
Again, same.
But again, I mean, most of those clients also have had issues with diarrhea, with nausea, with vomiting. I had one that had two clients that have had some dehydration issues.
And it can, there's some thought, and I feel like I've seen a correlation of increased meconium.
Yeah. I mean,
from baby, because it'll kind of stimulate baby as well.
I've only had a few clients that have done castor oil to like induce or augment labor, but all of them but one, their babies have had issues with meconium. Yeah. So definitely something to think about if you're considering taking this.
And I recommend, I had read a study early on in my doula career. I think it was from Evidence-Based Birth, but I can't remember for sure. Like that's where I'd read it. But is that studies have shown that castor oil is safe 40 weeks or later gestation. So like you don't want to do it 37, 38 weeks because it can increase meconium. And it's less likely to start your labor the less pregnant, like the earlier you are in your pregnancy. So you really don't want to be putting your baby at like, you know, a higher risk of some sort of issue with meconium, like aspiration or something like that, unless you're pretty confident that it's going to work or like your birth really needs to happen. So if you're like 2 days out from a medical induction, then maybe you would like to try castor oil. Or if your water's released and nothing's happening, then maybe you'd like to try castor oil. And I have seen it be quite effective for some people.
Yeah.
So,
for me specifically, if you've already had a baby vaginally,
that too.
That's when it like works the best, I think. Again, back to like the first time mom thing, like you just got to be patient, moms. Okay, so next,
let's take a pause for a second. Okay, we're almost done, guys. We've got 3 more to talk about, but really quickly, we're going to make another plug for rating our podcast.
Oh, I was like, wait, what are we talking
about? We are making another plug for rating our podcast on Spotify or iTunes or whatever it is, whatever platform you listen on. That really, really helps us out. And then following our social media. So at the NaturalBirth site on Facebook and Instagram. And then Tiffany and I have our own social media pages as well that you can check out in the description.
Yeah. We think that we're putting out really great information, and we want lots of people to be able to get this information. So it's really helpful if you rate and review the podcast, but also interact with our social media. So, like our posts, share our posts so that other people can see them. People on your friends list. Comments are really important. So just anything to kind of help us grow and get the word out there.
Absolutely. Yep. And a reminder too, I've said this in a few episodes, but the description links do not work on all platforms. And I have realized that recently. So if you're wanting to use like links from our description or something, you can go to the naturalbirthtalk.buzzsprout.com. And that's the actual hosting page for the podcast. And you can access all the links there if it's not working on the platform you're using. So, okay, back on track. We're on dates now.
We're on dates. So dates are a fruit that many women consume in late pregnancy. This is also one of those things that traditionally has been done for a long time. According to one study, women who ate 6 dates a day for the 4 weeks leading up to their due date were 74% more dilated than the women who didn't eat dates.
That's a big difference. That's 38%.
For sure. 38% more likely to have intact membranes. So their water didn't break before labor started. 21% more likely to spontaneously go into labor. 28% less likely to use oxytocin or Pitocin to induce labor.
Because guys, listen, that synthetic Pitocin that they give you in the hospital is not the same as your natural oxytocin. And some nurses or doctors will try to tell you it's the exact same thing, and it's not.
I mean, even the bag says oxytocin.
I know. And it really irritates me every
know,
single
me
time I
too.
read that. Cause I'm like, that is like,
It's not the same.
what is it? Not faulty marketing. What is that? Like dishonest marketing. There's a term for that of course it's escaping my brain right now.
Hang on. False advertising.
False advertising. Thank you. That is false advertising. That is not oxytocin in that bag.
Not the same. Right. And then the biggest one was a 77% chance of a shorter first stage of labor.
That's
so
some
that's
good
like
stats.
Yes. Another study looked at date consumption in late pregnancy as it related to like cervical ripening and found that women who ate 70 to 75 grams of dates per day after they were 37 weeks pregnant had 50% higher Bishop scores at admission to their birthplace versus the women who didn't eat dates, a 43% lower rate of cesarean section, 51% lower rates of vacuum and forceps assisted delivery, 55% less likely to use artificial oxytocin to induce labor, and then 68% more likely to have a successful vaginal delivery after a labor induction.
Those are really good stats. I have to be honest. I did not know all of those stats. I knew dates were good and I knew dates were helpful, but after you explaining like all of those too, I may kind of be a little more friendly with them like I am with red raspberry leaf tea.
It's definitely not going to hurt. The only special consideration that I would say is if you have diabetes or gestational diabetes, because dates do have a lot of sugar. Again, they do have a lot of nutritive benefits, but they do have a lot of sugar, especially if you're consuming like 6 dates per day.
Well, and that's something we should mention too. Sorry. Is that the size of the dates. So if they're like the large medjool dates, I think, then you only need like 2 or 3 of those a day. But if they're the smaller ones, then you need like 6 or 7.
It's the medjool dates that it's the 6 per day.
Are those the smaller ones then?
I think so. Yeah, those are like the little ones. I think the Nor ones are the like big ones?
I don't know, I guess. Let's see. Hold on. Now I'm going to look it up, guys. But either way, like it's not like the big size dates. You don't have to eat 6 or 7 of those. Cause I know a lot of people get really overwhelmed where they're like, this is so many dates. How do I eat these? I also think that you don't have to be super specific about the amount that you're eating because it's going to be helpful no matter what. And also you can get like Lara bars or like if you have an Aldi around you, that is my favorite store. They have like elevation bars and they're made out of dates. And they have like some protein and other things in them. And you can eat those. That was my favorite way to consume dates because it just made it really easy. But a lot of people, if you have a really good blender or blend them into a smoothie, you have to have a good blender, like a Ninja or something like that. If you have a crappy blender, the dates will break your blender. Okay, so we were both
wrong. Wrong. Okay, so the recipes that you see for like the, smoothies or whatever, a lot of them use the medjool dates. Which are the easiest to find like in grocery stores. The Neglect dates are actually the smaller ones.
Okay, that's the Neglect and Nor I think are the same.
Yeah, I don't know.
Okay, well, cool. Okay, so yeah, you don't need 6 to 7 medjool dates.
That's the freaking dates.
Just eat the dates. You can tell which one of us is better at staying on topic and which one of us is better at digressing. And Tiffany is way better at staying on topic. And I'm way good at digressing onto other things.
That's so funny.
Okay, Tiffany, get us back on track again.
Oh my gosh. Well, now I'm like, which freaking date is it? Like it doesn't matter, guys. Just eat some dates. Okay? Eat the dates. It doesn't matter. Eat however many you want, like it's whatever.
Do the best you can.
Do the best you can. All right. Okay. So next would be acupuncture. So in traditional Chinese medicine, qi is an energy that flows throughout the body along these 14 different paths. So acupuncture uses these very tiny fine needles. They insert them into specific points along your qi or energy pathways to stimulate the qi and your energy and your blood. So there are 361 different points on the body, and acupuncture should be administered by a licensed acupuncturist.
Yeah.
So in one
specifically someone who's good at women's health.
Yes.
Like you want them to have some extra training in women's health because then it's going to be even more effective.
For sure. So in one Cochrane review, they found that people who had acupuncture were more likely to have greater cervical ripening. And that was looked at by increased Bishop scores over a 24-hour period. So that was compared both to like usual care, no acupuncture, sham acupuncture, where they like pretended to do acupuncture with needles, but they weren't actually doing it. So when looking at that
How do you
Cochrane
fake that?
review,
I guess you just poke people.
I guess, yeah. So the true acupuncture did have a beneficial effect on cervical ripening compared to both of the other treatments. They also found that the acupuncture group had shorter labors, more cervical ripening when compared to those other two groups again. So could it be beneficial? Sure. I mean, I know that acupuncture can be beneficial for a lot of things, you know, pain and fertility and whatever.
I love acupuncture.
Same, yeah.
You finish.
I was just going to say, I find a lot of clients after they've passed their due date. I think that acupuncture actually works because it helps you relax.
Could be.
Yeah. Same with like massage. I know that massage, you know, can be very helpful too. So yeah, sure. Is it like helping obviously get blood flow to maybe some places where it wasn't before? I'm sure that has a benefit as well. But I've had lots of clients who really love and enjoy acupuncture. So as long as you're getting it done by somebody who knows what they're doing.
Exactly. And at the right kind at the right time in pregnancy. So like I got acupuncture my whole third pregnancy, mostly for like nausea and discomfort. I was so nauseous. It was rough. But I just remember one day I went in, I felt horrible. And I was like, okay, I'm going to go get acupuncture because I'm already out this way. And I walked out of there feeling amazing. Like it was like a total 180. And then I had acupuncture and I had a lot of migraines towards the end of my pregnancy, and it wasn't pre-eclamptic migraines. It was hormonal migraines because I'm very sensitive to estrogen and I was having a girl. So, and estrogen spikes at the end of your pregnancy. So I was just like migraine all day long. And I had been getting acupuncture for migraine pain. But a lot of the points for migraine pain are the same as induction points. And so I wasn't having all of the induction points done. I just had a couple hit because it was the same as the migraine points. And I went into labor the next day, like less than 24 hours from there. And I had a super fast labor. And I definitely think that I think my baby might have stayed in a couple days longer had I not gotten acupuncture the day before. Which, I mean, she was already past her estimated due date. But yeah, I mean, it's helpful within pregnancy, but it can be really helpful for induction also. But this is another one that sometimes I see it'll make the water break or it'll start prodromal labor. And that'll either stop and pick up again later, which is just really frustrating when that happens. Or like if it breaks your water kind of early. So, you know,
something to think about. Yep. Something to think about. Okay, so the last one that we have that we're going to talk to you about today is pineapple, which I know is kind of silly, but like this is something I hear people talk about all the time. So there is a specific enzyme in pineapple, bromelain, and then it's also in other tropical fruit as well. So it's said to induce labor by stimulating the uterus. It probably works the same way as like castor oil, just not as strong. So it stimulates your intestines, especially when you eat large amounts. So it's
or like
totally
the core. I've heard the core.
Normal
like when you blend
amounts
up the
of
corn.
pineapple, everybody. Like it's fine if you eat pineapple. I'm talking about in large amounts. It can sometimes help to get labor started. So either way, like pineapple is delicious. So
I love pineapple and it burns my mouth. It burns my mouth because of the bromelain. It makes me so sad. I can only eat a few pieces at a time.
So I want to tell like my own experience with pineapple, just because I think it's kind of funny, especially when people say that some of these things like don't work or couldn't possibly work. So when I was 39 and 4, pregnant with my son, I was 39 weeks, 4 days. I worked that whole day and decided to go to the grocery store right after work because we had no food, we had nothing. And I knew that I was going to be having a baby at some point within the next couple of weeks. So I go to the store, get all my groceries. And for whatever reason, there was this huge bucket of pineapple at the store that just looked so delicious.
Your instincts, they just knew.
So of course I got it, right? So I went home, cleaned my whole house, put up all my groceries, made this huge pot of spaghetti, ate a bunch of spaghetti, and then literally ate the entire container of the pineapple because it just was so delicious. And it was like very hydrating and just sweet and yummy and so good. And I woke up at 4:00 in the morning the next morning, and that's when my labor started.
You weren't even trying to induce labor.
Wasn't even trying. Right. Cause I for sure thought that I was going to be pregnant for like another 2 or 3 weeks.
Yeah.
You know, especially as a first time mom, I feel like it's just not common that you have your baby like before your 40 weeks.
Right.
It's more common for you to go past 40.
Yeah.
But yeah, I just think that that's kind of a funny story to tell, especially when people talk about how none of these things work. Like, well, in my experience and your experience, some of these things did work for us. And
absolutely,
we did have babies within the next few days after we did some of these things.
The key is these things are not going to work if your baby isn't at least sort of ready.
Well, right. Or your body. Right. Exactly.
Or your body. Right. And so like if you're 37 weeks and you're trying to induce, which we never recommend that unless there's again, a medical induction impending.
Real medical reason.
You know, like these things are not going to work. They may cause some contractions and like start and stop labor, which is really annoying. But like you, again, and we've already said this, but like you really don't want to purposely try to induce your labor unless there is some sort of like medical need for it, or just like you want to have a really good reason, because your baby and your body are like, they're both really smart and they know when it's time for birth. And so to try to push that along, like all of these things, you know, can be a lot better for augmentation. Acupuncture, that's something we didn't say. That's a great augmentation technique as well. You know, and all, you know, most of these things are really awesome for augmentation. If you've already started prolonged rupture, you know, like your waters have been released for a long time or whatever. Well, not sex. We didn't say that.
Yeah, don't do that.
If your water is broken, don't have sex, because you can introduce infection into your uterus.
Don't insert anything into your vagina if your waters have released. Yeah.
Same with like, you would want to insert evening primrose oil or whatever.
Yep.
Yeah. We probably should have said that while we were talking about sex.
Yeah, I know.
There it is now. And then one question I had, and I've been letting Tiffany do the outlines for these. She's so good at making them. And so like a membrane sweep we'll probably put in medical induction.
Yes. So we're going to put that in medical induction. I do not believe that membrane stripping is a natural form of induction.
I agree too. And when I first became a doula, I would have said differently. I would have been like, oh yeah, it's no medicine. Like it's just you know, whatever. But just as I've learned and as I've grown, I definitely would call it a medical induction. But some people still think of it. Some people still think of it as natural. So
yep. I had planned on doing that. Our next recording, we're going to do medical augmentation and induction. So yeah, that was going to be number 1 for that outline.
Perfect.
Yeah.
All right, guys, you know, I guess we're finding out that when Tiffany and I record together, we make it take a little bit longer. So our episodes just may be a little bit longer, but thanks for sticking with us. Again, most of that is because I digress.
That's okay. It's okay. I think people want to hear that we're real people and that we're, you know, we have real thoughts, and we're just
my favorite
normal.
is when I'm over here talking about a digression and you're like, okay, this. I'm like, all right, Tiffany's done talking about that.
We got to get back on track. We got to get the information to the people.
Which is funny because that's how I am when I homeschool. I'm like, guys, stop talking, stay on topic. But then I get to talking to you and I'm just like all over the place. So
yeah, I know. It's okay.
All right. Send questions.
Yeah, that's what I was just getting ready to say. If you guys have any questions or comments or stories about your experience with any of the things that we talk about, but specifically like natural induction or augmentation techniques, please reach out and tell us. Like, we'd love to tell your story on air and talk to you about it. So please do that. You can do that you could reach out to us like on the NaturalBirth site, social media, or on Rachel or I's independent social media.
Yep. You can also email us at contact@thenaturalbirthsite.com and we'll get it that way too. So you have options, pick one. We don't care which. Yep. And we would love to share it because we're going to have a question and answer / story sharing episode at the end of this series. So that'll be really fun.
Yay.
So anything else?
No, that's it.
Awesome. All right. Thanks guys for listening, and we'll talk to you in the next episode.
See you later.
Hi, Rachel Manns again. If you want to learn more, please subscribe to and rate this podcast, and head over to thenaturalbirthsite.com to check out our online natural birth education course, birth story blog, YouTube channel, and more.